Hey guys, welcome back to your practicum course. This is ATC 682, and I just wanted to address some of the syllabus questions. So I'm going to quickly pull up my document on my computer. Okay, so first off, I saw some themes within the questions for this assignment, and I just wanted to kind of broadly address them. If I still am not answering specifically what you need to know, shoot me an email or come on in, and we can address that specific question. So one main topic was about reflection logs. So last semester, I think I gave you guys kind of a general idea of reflection logs. You got the feel for what they are. That first semester reflection, I just want you guys to get in the habit of thinking about what are you doing in your clinicals? What's going on? What's going well? What's going poorly? I want you to reflect on specific scenarios. And so that's continued into this semester, but I want to beef it up a little bit. So I want you guys to really spend time reflecting on, now that you know athletic training, you're well versed on the day in and day out of an athletic training clinical practice. I want you to take specific scenarios, give me just a brief summary, that should be the briefest part, and then really reflect on what happened, right? What went well, what went poorly, how can you get better, or how can you change for the next encounter that might be similar, if it's an evaluation or a rehab or an emergency situation. You should always kind of be constantly reflecting. Reflection in our clinical practice is really going to make you a better, more thoughtful clinician, and much like making sure that history doesn't repeat itself if it's bad, right? Of course, if it goes well, if something goes really well, then you need to think about what was that, what did I do well, and I want to do it again next time. So that's kind of the idea. There is still, I know it's kind of informal, but you still need to have pretty good grammar. You should be speaking in an appropriate way, even though you might be describing a situation. You need to have good sentence structure. You should not have lowercase at the beginning of a sentence, and there should be punctuation. So make sure that you're still paying attention to those details, even though it's you might use some less formal language, and that's okay, but you still should have appropriate writing there. With that, there are some questions about replies. I don't need you to reply to every one of your classmates on the reflection logs, but if somebody asks you a question or they make a specific comment, I want you to be able to manage your own log. I give you guys a whole week to do some of those responses. So the idea is that you are, writing back to the people that have written to you, or if there's a discussion, if you have questions for something that your classmate did, which I encourage you to ask those questions. And that is a very high encouragement. Wink, wink. You should be discussing, not just saying, hey, oh, that sounds cool. Done, right? This semester, I'm expecting you guys to do more of a discussion since you have that full week to respond. Still, you only need 2 specific responses to a response to 2 different people, but you need to maintain conversations. And I think when you guys get in the habit of that and just kind of checking, you can also subscribe to different forums or different threads in order for you to get like a notification every time somebody writes on your thread. And that way you can maintain that through the week. So that's kind of the idea there. Let's see, looking at other questions. I think that was all for reflection logs. Okay, so the next is some of the surgical observation stuff. So surgical observations do not count as professional development. This is simply just an extra assignment this semester. We do it 1 semester out of the whole program. That is really structured. You only have to do 5 hours. If you want to do more, you're more than happy to. But I think you're approved for 5 hours through Mercy. And you're working with our orthopedic physicians through the surgery center. If you really have some questions, we have some more resources about the surgery center, but when you contact those people, they should give you all the information you need. With this, make sure that you have the appropriate documentation. So you need to do the that you make sure you take the quiz, do that pre-form, and then you're going to have a verification form that you need to get filled out, and it's essentially approval that you completed the 5 hours. You can log it, so make sure you complete that. Then we also have the something new that you didn't have last semester, the IP clinical conversations. So more information to come. What's posted on Blackboard now is kind of, you'll see the outline of how it's going to go throughout the semester. We are working with other programs. It's IPE, interprofessional experiences. We're working with other programs. You guys will get paired into groups, and that is still working. We had to make sure we got rosters from all the programs. So just stay tuned. I will make sure that you have prompts in your weekly content that tell you, how you need to be making progress on that. I'll make sure to make an announcement, whatever. And so kind of wait on me, because once that's developed, we'll go over that. And of course, if you guys need specifically me to walk through it, I can make a video, kind of show you what it looks like, or I can talk about it, before or after our in-person class. So I know it seems a little confusing right now because nothing is due yet. You will be put into groups with other healthcare students, and you'll have a conversation. You guys will read articles from each profession, and by the end of the semester, have that conversation and then do a reflection on it. So just stay tuned there. Okay, and then I think the third category, or the next main category, is encounter logs. I hear a lot from you guys that encounter logs can be, you're worried being at the high school, you're not getting as much treatment time, but you're still encountering patients, right? And that's exactly what it is. It does not have to be a treatment. It does not always have to be a super formal evaluation, but you are logging the time the encounters that you're having with your patient population. So if that means you're doing a whole lot of giving ice, that sucks. I'm sorry that, maybe you're just handing out a bunch of ice and that's all you're doing. But we need to kind of know that. So what we're kind of asking is log in as many encounters as possible. And that way we have an idea of what's going on at your clinical site, and it's a good representation of that. If you're doing a lot of evaluations on court evaluations, maybe you're even just observing evaluations or treatments from your preceptor, don't forget that in those encounter logs, you can write, it's like observed, something in the middle, and then you performed it independently. Make sure you're rating that so we know, okay, you're observing a lot of evaluations, and so this time, especially upper extremity, concussion, or neck, or shoulder, you don't have any information there. And so, and you don't necessarily have all the skills. So it's okay if you're just observing those. I encourage you though to ask a lot of questions, take a lot of notes, right? And debrief with your preceptor about what they did and ask questions about why they did that. So don't worry too much that they're just gonna look a little different, and that's okay because high school is a different setting. The time is spent differently. The student athlete and a patient population is vastly different, and I think less reliable in coming back and doing treatment. And that's kind of probably why that looks that way. Let's see. Don't worry about formatting. It kind of looks weird in there, and that's okay. If what you format looks differently once you submit it, it's okay. Mainly, I want it's about substance, like how much is there and what is there and the quality, not necessarily about like how it looks, because eValue is kind of a little junky with when you submit documents like that, it reformats it. So don't worry about that. Katie, somebody mentioned something about like, do I need to rewrite them because Katie looks at them? Katie doesn't really actually look at them, but they do. We will like report like we're using it for a report that we'll submit to Katie. So don't fret too much there. Okay, let's see. Please make sure you're putting good information on those encounter logs, what the patient population is and age and those kind of things. That kind of helps us too. Okay, and kind of the last question, and I want to talk a little bit briefly about this is, it's not in the syllabus because it's going to fall under more of our weekly assignments, but we are gonna do a, it's more programmatic, if anything. We're gonna do a standardized patient simulation at the end of the semester. We're in plans of making that. We didn't do it in the fall, partially because I was on maternity leave and I kind of head that usually and get it going. And we just kind of got behind, but we will be doing one this semester. A standardized patient is essentially an actor is in the room and they're playing a patient. They're going to pretend to have an injury of some sort, or fill in the blank. They're going to be your patient. Who knows what is wrong with them? And you will walk in blindly, not knowing what's about to happen. What they're going to tell you, and you're going to do an evaluation, or you're going to address the patient and address their needs. So with that, you might do an evaluation, then provide some treatment or some education or a referral. Sometimes these scenarios are more emergent, where you need to, quickly decide on a referral process. But you won't know any of that until you go in, and that's kind of the fun of it, is that it's supposed to simulate a real life situation. Often a patient comes in, we don't know what's about to happen. We don't know what they're about to tell us. And so this sometimes we don't get those experiences. Many of you might not get a ton of it in high school, or, if there's areas that we just don't see in our clinical site, then we're going to address it in these standardized patients. And hopefully as we go forward, you'll do more of them. And you'll do a couple next year as well. So we will be doing SPs at the end of the semester. Nothing you need to do, nothing you need to prepare for. We will tell you when it's going to happen. We will tell you where to go. You can be passive in that, in the fact that we'll address it when it's time, and I'll tell you. Other than that, that was the majority of the questions. Again, if I didn't address one of your questions, if I missed it, or it didn't get, it was in one of these themes and I simply didn't specifically answer it, shoot me an email and we can talk about it. Or pop on in and I can answer that specifically. But I am really excited for this semester. I'm really excited to see where you guys grow and expand your knowledge. And I think this semester review even is a little more, little fun and a little different in the fact that we really dive into some more content that you learned last semester, and we continue to progress that. But again, reach out if you have questions, and I'll talk to you guys soon.